You're tuning into the Active Mom Podcast with physical therapist, Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right. Every once in a while, I get to bring somebody on the show that has known me longer than probably most people. And today's one of those days. I'm super excited to bring Reshma Rathod on the show. She was one of my very, very first managers and the first manager as I was a budding pelvic health therapist. So I'm sorry you had to put up with 20-something me. But she's gone on to do pelvic health herself. She's a mom of two and has gone on to do really awesome things in the tennis world. So Reshma Rathod, thanks for being on the Active Mom Postpartum
Of course,
Podcast.
happy to. What an honor and privilege. I'm so
All
proud
right.
of you.
Thank you. I'm so proud of you. Like, we've known each
So proud of
other.
you.
Gosh, when did I come to NRH? 2001?
Should I date it? I definitely before 2000.
It was because something happened on the 11th of every month that year because it was right before 9/11. I think we had the flood. We had a whole bunch of things. So it was very eventful foray.
Yeah.
But tell us a little bit about who you are, where you practice, where you're from. You know, give us the quick 411.
The lowdown? Sure.
Yep.
I'm Reshma Rathod, a physical therapist. I am co-founder of Restore Motion, located in Rockville, Maryland. And Miriam Graham is my business partner. And we created Restore Motion back in 2004. So we're going to be celebrating our 20 years in 2024. Really excited about that.
That's a long time for a private
It's
practice.
a long time to, yep. It's like your third kid, right? So we're excited about it. So the reason we created Restore Motion, we were two young moms and we wanted to have more flexibility in our day so that we could be home for the kids. And we thought, who's going to want to come see us, but let's just start up this little practice. We do not participate with insurance. We're out of network providers. And we opened up our doors back in 2004. And then, the rest is kind of history. It's been great. It's been a great ride. Our niche is, we started with women's health, which became pelvic health. And then, but we see all sorts of diagnoses. We also, we treat athletes, we treat dancers, and we treat kids, men, women.
All the
So
things.
it's all the things, absolutely. And the other part of my experience at Restore Motion with the female athlete aspect of things, I'm also one of the primary healthcare providers at the Women's Tennis Association, and I've been doing that since 2007. And my initial responsibility was to kind of bridge the gap between manual therapy, which was kind of my strength, with sports and sports therapy. And eventually, after bridging that gap, we brought in some of the women's health aspect to the female athlete. So we thought, we needed to bring in the pelvic health component to all these women all over the world, that play this elite professional athletes that play this sport, and they weren't given the information on pelvic health or women's health. So
I
we
love
started
that
that journey as
snuck
well.
it in. You're like, all right, I will meet you with the sports ortho, but I'm going to bring in the pelvic health because it all goes together, which I love.
Absolutely. Remember those chronic hamstring pain, like strains, or the hip impingements, or the chronic SI problems? It wasn't getting better. And then when I snuck into that pelvic floor area, all of a sudden it was, it made that difference.
I love that. I think you were one of the first people that I had worked with that I think got the connection. Like we're the ortho people first, and then we brought in pelvic floor, and then we're like, wait, this is just a mashup. It doesn't have to be these separate things. And I feel so fortunate to have started in that way. Didn't realize it for a long time, but it should be a mashup, right? It doesn't necessarily have to be pelvic floor or bust, right?
Not at all. It was like that. For me, it was that missing piece of that puzzle, right?
Yeah.
So you would treat the musculoskeletal area with low back and pelvic or hips, and then And then you have this pelvic floor, and like,
Right.
of course they're related. Of course one affects the other. So, my journey with the pelvic floor, I was initially, there was a urogynecologist moving to the area, and she needed a pelvic floor physical therapist. And both Carrie and but we both worked at the National Rehab Hospital, and they wanted a physical therapist to do pelvic health. Well, I was asked, and I was quick to say no. One, not knowing what it was all about. Two, I wasn't sure if
Is
that's
that
what I
how I
wanted
got
to do.
hired, was because you said no
No, you
initially?
didn't get hired for that yet.
Oh,
That was in
okay.
Karen Library.
I was like,
Then I
wait, I don't
pointed
know
my
this
finger.
story.
Then I pointed my finger to another colleague. I'm like, but she would be really good at it.
Mm.
And
Was
then
that
we sent
Karen?
her to, that was Karen. And
Karen
then we sent her
Liberie.
to all the courses, and then she did phenomenal,
Yes.
grew the practice, grew the program. And then
Yep.
my supervisor, Jenny, came back to me. She's like, okay, now you need to go to this course. I'm like, I'm not ready for this. I teach the network. I'm going to do manual therapy. I'll do musculoskeletal stuff. I'm not doing the pelvic floor. This is the first time I say I was bribed, but usually, kind of, what do they do? 80/20, 40/60, whatever. And they said, we will send you at 100%,
What?
all travel expense paid. You go to the
No.
course, we need you. And I was like,
Okay.
okay, I'll go.
Oh
I
my,
was like,
I
but no
did not know
guarantees
this
that this
part of
is
the
what I'm going
story.
to do. Oh,
Okay.
and oh, no. And guess what? Jenny goes, oh, by the way, I'm coming with you. So now I have
That
my
I do remember.
supervisor coming
Yep.
with me to this course that I really didn't want to go to. And we agreed, and we're like, but we just can't be each other's lab partners. That's where kind of I drew the line with that part, because I had no idea. And
Right.
we had a wonderful time at the course. It was mind blowing. Holly Herman was teaching it, so it was
Yep.
phenomenal.
Yep.
And again, it was like that missing link. The light bulbs were going off, and I was just really excited to be part of this program. And then that expanded, and then in comes Carrie.
Did
You.
I feel like I came before that though. Like, did you start to get trained when I was leaving? Because I
I
remember when
think
you went to the course. Because it was Jen
then
Chu
maybe
and then Karen Liberie, and then I came. I wasn't there.
Jen Chu was. I don't think Jen was
Jen had
there by then.
left, and then
Jen had left. Yeah.
Brittany
Karen
Lemoyne
Liberia.
was
Brittany
after
came
me.
after.
Yep.
Brittany came after. I thought maybe I'm not quite sure the exact timing of you and
Yeah.
I
But
then.
I'm really
Yeah.
jealous though, because you had already been out for a bit. You had all that manual therapy background, you had that orthopedic background. I had only been out maybe I got hired and I was like, okay, I just want to get out of upstate New York and come to DC because
Hmm.
there's nothing going on up there. And they're like, do pelvic health. I'm like, I don't know what that is, but it gets me to DC. So let's go for it.
Okay.
But really had no sense that you know, how important that information was gonna be later on, and I'm really kinda jealous that you kind of did once you're like, "Oh, this is where it fits in." It took
Right.
me, I think, a few more years to wrap my head around that. Like, kinda pull that forward to tennis, like, they brought you in because you're, you know, super expert in manual therapy and you understand tennis because you played for a long time, yes?
I played in high school. I played in
Okay.
high school.
You played longer than I
And
did, which was 0, so
nothing in college really. Nothing since I've became a mom and started working. But
yeah,
um but
but they brought you in with that
yeah.
expertise. Like, you kind of briefly touched on it earlier, like, you started to pull it in because you would have these, like, hamstring strains and things like that that didn't resolve. Like, how do you convince this large organization that pelvic floor is the answer?
Well, it wasn't just the answer, it was just the approach. And it wasn't necessarily the convincing. Here's the thing with elite athletes, and even in a professional sports, if it's all about performance, right?
Mm,
So if they are now able to perform and they're performing even better,
right.
it's done. They're convinced.
Yeah.
So, as a joke, they were calling it the Reshma special. And it was just the obturator internus release externally, the external obturator,
Right.
and like, I need, like, so if someone has limited hip internal external rotation, that's a musculoskeletal assessment. And then
Right.
you go there to release the obturator externally, and then all of a sudden their range improves. Well, that improves their mechanics. Now they can
Mm,
surf better. They can hit their with more power because they're not limited in their hips anymore, and they can actually get the trunk hip counter rotation aspect of things. So once when they were able to perform and with better technique, that was the convincing. I didn't have to
Mm,
really do anything. It was the athlete's performance more than anything
yeah,
else.
that's what sold it. Yeah, completely.
Mhm.
Is there just I don't know anything about tennis at all. Is there a difference between the access? Like, are you working with just the women or are you working with both the men and the women? You're working primarily with just the women, right? Yeah.
Yeah, my role is just with the Women's Tennis Association, but we collaborate with
Hmm.
the men medical team, and
It,
especially with some of these combined events, where they're men and women both playing the same events. We're definitely keeping in touch with the other, but two different entities.
do the women have like they haven't had access to on-court care as long, have they?
Um,
Like just
on court care.
or just even yeah, even just having you as an option to go see, like, I'm just trying to kinda get a sense of, like, have do women have the same access to, professional medical care on court, as much as men do?
Absolutely. So that we're usually a team, depending on how big the tournament size is.
Mhm.
So, like at a big Grand Slam, we could be a team of 8 to 10
Mm,
physical
okay,
therapists, and from all over. And so it could be a colleague from Australia, a colleague from
got
Europe,
it.
a colleague from, Argentina, a US based colleague. So it just really depends. And then
Okay,
we also team up with their local physical therapists as well. A smaller event like the event here in DC, that would only require 2 or 3 physical therapists in the training room.
got it.
Um,
Okay,
our team is mostly based at the WTA. The team is mostly based. It's consistent of physical therapists. So every primary health care provider right now is a physical therapist,
gotcha.
that specializes in, sports or some other specialty.
Okay. And for the women that are competing now, there's definitely been more of a shift. I think I've seen it in a lot of other sports as well, where you're getting women returning to sport after pregnancy. So how has that shifted kind of the care that you're giving while they're pregnant and then kind of transitioning into postpartum?
Yeah, so it's been really interesting. WTA has partnered up with a company called Hologic, and it's a data tech company. But I believe based out of in Massachusetts, and they're there to like really capture the data from these
Mm,
athletes and make some changes and make and really promote women's health. And they've decided that with WTA having been consistent of all female athletes global from all parts of the world, this would be a good company to partner up with. Um, so they developed a task force of like how to improve women's health and capture this data, and then that way that data could be used for another population, another sports industry. And so right now we're actually developing a postpartum return to play program, and then
ooh,
so with that return to play program, maybe that will transition into return to work, you know
right.
postpartum return to work program for another physical therapy clinic or
Yeah.
another healthcare provider. So we're really working on the research on that and that. And so kind of getting back to your question, so I'm part of that task force, and I'm very grateful to be part of that task force because I'm working with so many like all these smart women,
There's
smart,
some
smart,
smart
smart,
people on that
smart
task force.
women
I've seen the
out there.
list. Yeah.
Oh my goodness. And so and it's just really neat where now we're capturing, okay, what did these athletes do beforehand and what did they
Mhm.
do? What are they doing now? So I actually had the privilege of working with Lindsay Davenport. She was a high ranked athlete. She had a baby, went out on maternity, had a second baby, went out but came back. But she was coming back after 6 weeks, I think 6 or 8 weeks.
Mm,
And I see her first, and I was like, okay, before you go out on court, I got to look at you. Let me
yeah.
clear you. And I was just looking at her abdominal core stability, basic assessment, and noticed that, you know, she she had a C-section scar, so I was just looking and mobilizing her C-section scar, and I was like, "Has anyone ever worked on you?" And she goes, "No one's ever done this to me before." So that was the aha moment of like, "Oh my gosh, you're
Mm,
a professional athlete, but no one's mobilizing or working on your core."
yep.
And then we had the conversation of, well, if your tissues aren't moving, your muscles are not going to be able to contract appropriately, you're not able to generate the force, you're more predisposed to injury. So kind of educating that aspect of it. So that was way back, I wouldn't say 2008 or 2009.
Mhm.
So now fast forward 2024, there's a huge task force. There's a team of experts really working and looking at the evidence and the data to generate new information. And so now I had the privilege of talking to, I want to say, at least 15 athletes when I was in Paris this past summer and asking them about their postpartum experience because
Mm.
back in I want to say early 2000, there were like 4 out of the top 200 tennis athletes were moms.
Yep.
Now I want to say that number has exponentially
Yes.
increased, right? And so we know a lot of athletes being pregnant. We know a lot of athletes coming back after pregnancy, and so the majority of them during pregnancy, I mean, we all know that exercise is beneficial during pregnancy as long as you're not doing vigorous exercise and you maintain your vitals. And so because they're used to the exercise program, they're used to moving, they continue with their program and modify as needed. Um, After pregnancy, the information varied. So you had women that had the full on support from their country's maternity plan.
Mhm.
Okay. And they had midwives, they had doulas, they had pelvic floor physical therapy was mandatory, a lactation consultant was mandatory. So they had that support. But then you had the extreme. You had the extreme of like, no one told me what to do. I had no idea what to
Yeah.
expect. I went for my 6 week postpartum check and they said as long as I was okay and I could go ahead and resume my activity. But no one gave me the information of how I could resume my activity, my level of
Right.
sport. And so there's definitely a wide range of education that needs to be done
Yeah.
um,
I think
for
that's
the
pretty
for the professional
consistent.
athlete.
That's
Yeah.
pretty consistent that what I've heard across sports. I mean, I obviously pay attention to running and CrossFit a little bit more, but it's pretty common that like we have this assumption that because people are pro athletes or very high level athletes that they have this gigantic support system. And it's just not necessarily the case, and they have even more issues because like the heart rate guidance or the vitals guidance, like that would be like a rest day for them,
Right.
and
Exactly.
that's why I do think that there's gonna be some pushes forward in, research to be like, "Hey, you know, let's focus on where these women we need to meet them where they are because their capacity, on a slow day is probably on my best day," And, like, we
Right.
need to be able to give them resources that are better than just keep doing what you're doing, like, because that's not really fair either. What is it
Right.
about
I mean, I
tennis?
think
Yeah, go
it's
ahead.
I think I was just gonna say the other thing is it's even the transition of becoming a mom, right? And so a lot of them
Mhm.
was like, I had no idea this is what it was gonna be. They
No.
report their sleep issues, they report
Yep.
nutrition issues, they report, I didn't realize I had to eat so much if I'm breastfeeding. I didn't realize, how sleep affects, how I function. And even the mental health aspect of it, of like just the transition of going from being a mom of somebody that's supposed to be peaceful and nurturing to whereas an athlete is perceived as, tough and strong and, competitive. And so
Yep.
there's two different extremes, right?
Yep.
And where do you fall and how do you achieve your professional goals and your personal goals at
Yeah.
the same time?
I think that's such a different conversation sitting here today in 2023 than it was back then. I mean, I'm literally just thinking in the last month, Tia Toomey Orr, who was six-time fittest in the world CrossFit, she just performed at the Rogue Games, got second only by 10 points, by the way, 5 months postpartum.
Hmm.
Steph Rothstein, she third kid running, she just did the 5K at New York at 6 weeks postpartum, but I know her PT, like, she's on top of it, like, these are things
Hmm.
that, even just last year, 2 years ago, we're like, "Is this possible?" And I love that we're asking these questions of, like, is it possible? The fact that moms are returning to pro tennis after having a baby. It's not like, okay, you had your baby, you're done with your career. Like they're coming back. And I think it's this beautiful renaissance of these women saying, hey, I still have more left in the tank.
Right.
So with tennis, knowing I know nothing about it, um, what are things that are unique um, to returning somebody back to that sport that you would need to consider over just kind of the average person? Like what kind of performance capacity do they need to have? What sort of like agility, coordination, strength? what are areas that are unique to tennis?
Um, Honestly, for the postpartum return, it's very similar to the return, like when, if you're returning to running, if you're returning to any sort of sports,
Hmm.
it's just really making sure that they're getting their core activated, making, addressing if they have a diastasis, addressing the diastasis, addressing just gentle endurance, cardiovascular activity. Once when they have a good firing pattern of their core and their abdominals and even their pelvic floor area, to really work on some of the strengthening aspects of their 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 general program per se,
Hmm.
before they move into their sport specific type of program. At the WTA, for the women's, like especially in the sports arena, now they can like claim a special ranking.
Yeah.
And so like before they deliver, before when once when they're pregnant, they said they stop playing, they can apply for special ranking, and that special ranking they can keep, I want to say, up to 2 years. I want to say up to 2 years, so they can actually gradually come back. And so it's
Ah,
not where, "Oh, now that I'm done, I have to now perform at a certain level." They can still keep their special ranking until they are ready to fully come back, but there is a time frame, and I can look and see what that specific time frame is, but I wanna say it's like it's almost 2 years.
has that
And
always
so
been the case? Like, is that kind
mhm,
of
mhm.
who do we have to thank for that? Because we're literally just now getting marathons that are allowing you to defer, like your Boston entry or your New York entry by a year or something because of pregnancy. Some people some races are still making you eat the entrance fee that you already paid, but
Mhm.
like I feel like might be a little forward in this that they're allowing you this time to come back.
Yeah, I think I kind of, but I don't think it's, again, I don't know the details of this,
Yeah.
but I believe it's, for like it's an injury, right? It's a surgery. And so
Isn't that unique
it's
and
it's to return to
interesting?
play, right? How about that? And so I don't think it's necessarily classified as a special case. It's just this
Okay.
is the general guideline. But again, I don't quote me on that, but it's pretty
Yeah.
much similar to if somebody had an ACL reconstruction, their special ranking to return to play. They have a special ranking to return to play as well.
So call me crazy, but shouldn't that be how it is for all sports? Like,
I mean, in Europe, isn't it mandatory? Like, what's their maternity leave policy or family medical leave policy? A year before you come back to work,
yeah,
versus 12 to 16 weeks. I mean,
yeah. Maybe I'll switch
yeah,
to
but
tennis.
absolutely. And I think the support is very different, where it's like, instead of having a mandatory assessment or evaluation, it's like, okay, go do your stuff. You should be fine. It, it,
Yeah.
it really depends on the support. But we've had some of the athletes, like we have, I know three moms that are planning on coming back next year.
Hmm.
Well, one just came back. You have Caroline Wozniacki, who was a top ranked athlete. She now has two kids, decided retired, now is coming back, came back because she wants to prove to herself that she can do this,
Yeah.
and while balancing professional and personal life situations. I think Naomi Osaka is coming back. There's another woman, Svitolina from Ukraine came back with her kid. So you're seeing a lot more and more women coming back with their kids. As a matter of fact, sometimes the tournaments have to have a daycare on site
That's great.
to help with to balance some of that. Yeah,
You're starting to
so
see more
they're
of that
incorporate.
in running. There's a group and mother that's doing that to
Hmm.
offer lactation places to breastfeed, and then I
Right.
think there's another group that's starting to do more kind of childcare, nannying, that sort of thing, while moms are out running marathons. So I'm glad to see that
Yeah.
that's kind of more across different
Yeah.
sports.
They're trying to
For
support that.
for tennis, one of the things that I'm thinking about is two challenges. One is you've got to navigate impact. And then there's also the question of physics, which I think is so unique with, how you have to exert force far away from your body or across your body or things like that. How do you, let's say you have somebody that you're working with, pro or not, that let's say they're just having difficulty just doing like shuffling across the court or just, volleying with friends. Like, where do you start with somebody like that?
I think, I mean, initially, with no matter what, with just, I'm automatically thinking tennis is a rotational sport. So just
Mm,
like soccer, just like golf. Okay. So you want to make sure you establish that rotation. my initial go-to is making sure I get that thoracic spine moving,
Yeah.
especially postpartum. I get, they're breastfeeding. They've carried this belly out there for, at least 2 or 3 months, in the third trimester.
Yep.
Um, and they haven't really moved out around. It's hard to move when you're pregnant, right? It's hard to
Yes.
flip over in bed. You're always having to get up and then turn over. So immediately I start with the thoracic mobility. And I feel like when you've improved that, you have the shoulders, you're able to, use the shoulders more functionally. And then you also get the hip mobility and the hip mechanics with that thoracic rotation as well.
Yeah.
So I tend to go with that, and then after the thoracic rotation, I'll most likely I'll probably get into the hip pelvic area as
yeah.
well.
I love the thoracic spine with postpartum women. Again, I think for the same
Mhm.
points that you were saying, like in pregnancy, we're just so locked into that
Yeah,
position as baby grows, and then you have to counter the whole boob scenario, and not and just being curled up around going from an A to
right.
a C or something
Yeah,
like that. Like people don't realize how much trunk mobility and how much they lose, and how much those ribs kind of change position and so on.
right. Yeah,
Um,
and actually, there's a breast science, and there's evidence and information. It's part of this Hologic team of like breast mechanics and breast mobility, and how the
yes,
breast mechanics and breast mobility affects performance and speed, right?
yes.
And so it's just like looking at the mobility and motility of the breast and the breast tissue. And a lactating breast tissue is very different than a non-lactating breast tissue. So all of that goes into play as we're working on this mom returning back
Right.
to play.
I did not know any of that, and I think I was talking to, oh my gosh, maybe it was Christina Gresta, who she does a lot of, running shoe mechanic sorts of things, research, and she had turned me on to some, researchers in Australia, and we're trying to get one of them to come on the podcast. Obviously, the time zone thing is tricky, but, boobs are it impacts, like, do you hit differently? I mean, obviously, you move differently, but how do you kinda reach across to you can insert a in tennis word here. Like, what's that when you hit across your body?
The backhand?
Yes, thank you. I was like, I have no words here.
The
I
backhand?
I'm floundering. Yes, backhand. But like, how do you help somebody navigate that when now you've got like extra quantity
Right.
up front? Like that
Oh.
affects mechanics, right?
So the supportive bra, right? And so the bra that you used to wear before you were pregnant and the bra that you should wear postpartum are very different. You
Yes.
can't go back into that old bra, and if
No.
if you wore like a Lululemon bra beforehand, that might not be the right bra for you postpartum. So
Yeah.
it's just making sure you have the right fit and the right support. And then again, if yes, this their posture has changed, right? Like
Yeah.
the center of gravity has shifted a little bit, and so again, kind of I feel like back to the thoracic rotation and the stability, the core stability of that.
Yeah, I would think with trying to find center of balance again when you're trying to kind of be agile and move across the court probably
Mhm.
is pretty important. What about that
Yeah.
person that overhand? Yes, is that the right word?
Serve. Yeah, overhand is
Serve.
good.
Yes, thank you. Okay,
Serve, overhand,
I forgot you
serve.
have to serve the ball, right? But to do that, what if when they're hitting the ball, that's when they leak? Like, what kinds of things do you want to dive into that point? So, like,
Oh,
everything below the shoulder, they're fine, but as soon as they go above the shoulder, physics, lever arm, all that good stuff, that's where they get into trouble. Where do you start to look? Where do you end up typically with these
yeah.
with these patients?
And that happens, by the way, and it wasn't until about, I'm gonna say, uh, so every year these athletes go through a physical, an annual
Mhm.
physical. Um, let's say prior to maybe 10 years ago, the question was not even asked during their annual physical, do you leak with exercise or
Really?
running? So we put that question in there. We're
Thank
like,
you.
these athletes need this question, and do you have pain with insertion of a tampon? It's like we didn't want to get into the sexual health or any of that stuff, just because we have a variety, a huge age group of
Yep.
athletes coming through. And so it was finally asked, and that year I happened to be at that tournament. They're like, "Oh, they told me to come see you because I answered yes to this question." And
Oh,
so they're like, I thought it was just me. I didn't think other people had this issue. And so, one, it was
Wow.
this mind blowing to them that others could also be dealing with the incontinence issue. But that does happen. It's a real thing,
Yeah.
and so a lot of it is just really looking at the coordination of the abdominals and breath. Just like you would treat somebody in the clinic, you would also treat very similarly, but in a functional way to that athlete, right? And so a lot of these athletes, it's almost like you almost have to down train to up train them
Yep.
because they're used to firing a certain way. And so their way of their firing pattern may be the issue versus they could be strong, but
Yep.
they just don't have the right motor control or firing pattern to help with this. That's the reason why they're having that leakage issue. So, in those cases, I don't think it's a necessarily a strength issue.
Hmm.
I think it's more of a coordination and a stability issue. And so we talked to them about different breathing techniques. We talked to them about how to recruit their abdominals. It's not just all rectus focus. Let's work on your pelvic floor. Let's work on your transverses.
Yeah.
Those are muscles that they haven't really been instructed in. And if you really think about it, a lot of their coaches, a lot of their fitness trainers are males.
Yeah.
Very, very few female coaches on tour, even fewer fitness coaches on tour. So
Hmm.
it's not being addressed, right? So they're training them with a male hat on,
Yep.
using a male, I guess a male template per se.
Yeah.
And so, and for the female to actually talk to the male coaches about these are the issues. One, it's embarrassing. They're not going to do it, right?
Right.
And so they kind of just, unfortunately, they had to deal with it, or they just dealt with it until we were able to kind of create a communication lines for them. But but again, talking to them about proper technique and recruitment pattern is usually the way we go. I mean, with any pelvic health postpartum, I mean, our foundation is core, right?
Yeah.
Making sure they have a strong core foundation, and that's including the pelvic floor, abdominals,
Yeah.
multifidi, diaphragm, all of that canister, right? That
Yep.
canister that we love to talk about, and just addressing that canister concept.
With something as dynamic as and unpredictable as playing tennis, like how do you kind of reteach? I know this is a huge question, but how do you kind of reteach coordination at that speed where you don't know where that ball is going to come back? You kind of have to take what comes. Like, how do you retrain that uncertainty?
Um, Going back to basics again. So sometimes it's really getting back to teaching them how to fire, let's say, their transverses with their pelvic floor, getting back to maybe like supine heel slides, right?
Yeah.
I mean, it's basic as that. And then once when they're able, the light bulb goes off very quickly for them. Their bodies are very, very, very smart. So
Yep.
once when they get the right pattern, it's a matter of just progressing them through, from supine to sitting to standing, and then adding in a little bit of the hops, the jumps, the skips before
Hmm.
we start doing on court, running and foot drills and that type of stuff.
Gotcha.
But there isn't like a fancy equipment. We're not, we don't have electrodes or leads on
Oh
them or anything
no.
by any
Yeah.
means. But it's just, once when they're able to integrate that and have that
Yep.
awareness, then it's very quick for
Yeah.
them.
And I would assume the progression, just kind of basic physics, like you would start with movements closer to the body and then work your way out, and then same
Absolutely.
with force. Yeah. Yeah.
Yeah,
Darn
and
physics.
with movement and even just basic positioning, right? Like, yeah,
Right.
I went from supine to sitting to standing to
Yep.
kneeling to, so and we try to work in a collaborative way. So if we're seeing something, then I may have that discussion with their fitness trainer of
Mm,
like, okay, let's not work at 50 pounds is not what's important. Making sure that
right.
let's decrease the weight, but making sure that she's recruiting her muscles in this capacity. And so it's just often a fine line because we don't want to step over people's toes sometimes. And and so it's just a matter of like, this is a great program, but let's work on this instead, and then she'll be able to do this program even better.
Yeah.
So
Yeah. I think that makes sense though, because like you have these stereotypical things that you would be doing, and then where do we fill in, where the deficits are that affect their function and whatnot. I totally forgotten until you said something like that a lot of girls get into high level tennis at a young age. Have you seen any sort of, I don't know, pattern to, do they tend to be more on the high tone or overactive side of things that they're coming and complaining about pelvic floor issues early? Is that anything that's starting to show itself now that you're asking the question?
Um, for the younger population, we're not necessarily seeing it as
Yeah.
much. But I'm not seeing it in the older population either. I'm really seeing it, I mean, I'm calling like 25 and up,
Yeah.
you know. When you're younger, I'm thinking like 16,
Yeah.
18 and young,
Yep.
but I'm not hearing anything from that population. I'm hearing it more from like the 25 to like the 30s.
Yeah. No, it's because you have the background in dance as well with Miriam. Like one of the things that I have the last couple of years been asking patients is what sports they did growing up, and I find that the more aesthetic focused sports, like a ballet, like a figure skating, dance, that kind of stuff, there's a little bit more predominance, and who knows, maybe that has to do with the increased mobility, more kind of high tone later on, but then again, we have a lot of runners that are getting a lot of high tone sorts of presentations pre-pregnancy. I just didn't know if that was something that's starting to show itself, and or it's more unique to certain types of sports or things like that. I don't know what your
Yeah.
thoughts are.
So in the high tone population, this is where we're seeing your chronic hamstring strains and the glute
Ah,
strains
okay,
and the hip impingements and the SI. So we are
okay,
seeing, increased tone and tension in that situation.
yep,
So that's how they're presenting themselves. They're not
ah,
presenting as leakage or
okay,
pain or any of that stuff. I mean, the
okay,
pain from the musculoskeletal standpoint. Speaking of dancers, like Miriam recognized that, like the turnouts, right? Like,
yes,
then that's important for the dancers, right? And so improving the turnout and how the pelvic floor improves or can help assist improve that turnout aspect of it with the hip mechanics. So she is actually teaching the School of Washington Ballet.
yep,
Again, these are the young girls. These are, the
yes,
young girls, like 12-year-olds, 8-year-olds, and the instructors on how to do a proper turnout. So it's not like you're sticking your chest out and, you're trying to get the turnout from your lumbar extension. You're getting the turnout
right,
truly from the hip. And so we're working on even in the ballet population, at least here, starting at that level
yeah.
of proper mechanics.
Yeah, no,
That.
I had a previous foray at a clinic where they did a lot of dance, and I knew
Mhm.
nothing about that either, and just the idea that instructors were, like, forcing these girls into that, and hopefully it's gotten better now, but I didn't know, like,
Right.
certain sports, they'll force you into a certain position or whatnot, whether
Right.
your biology
Well, we
can
saw
navigate
that
it or not.
yeah, and that we did when we started at the school, that is what we saw,
Yeah.
and then we were very quick to start with the education process.
Yep. No, and I think that's so important that, like, there's ways that we used to do things and train people before that you see later on in life do cause issues and problems, and like how can we get ahead of that and train our girls better, and maybe potentially not set them up to have these issues and so on. But it is really interesting that you're like, okay, if you're having these kinds of injuries in the sport, you may be more likely to have this correlation with a higher tone. Because again,
Right,
somebody's
right.
going to talk to you about that as a physio way sooner than they'll talk to you about painful tampons or leakage or things like that.
Absolutely.
So,
Your chronic the other thing that I was just thinking about is your chronic groin strain or adductor strain or
right.
your chronic abdominal strains. So we
Hmm.
see that a lot, often like, an adductor strain on the left and an abdominal strain on the right. And
Yep.
so, that's your anterior sling
Right.
pattern, right?
Yep.
And so what's right there? It's your pelvis, it's your pelvic floor. So
Yeah.
that connection's not being made, but that's another aspect of, all right, let's go ahead and delve into this a little bit more to make sure
Yeah.
that both aspects are being addressed. Yeah.
Yeah. And that's where, again, I don't understand how people can go into pelvic floor PT and not have a background in orthopedics, because it goes so many other places, and that's where I feel really fortunate to kind of been brought up in that environment where it was very sort of normal, but I didn't realize it. And then eventually realized like, hey, this should be all together. It should be a mashup. So it's so cool to see that that's at the highest levels of tennis. This is, it's still working. It's still
It is
working.
still working, it's still working, there's no special formula, it's just,
No.
and I keep telling everyone, it's like, if we just think about all the stuff that we've learned in PT school, just
Yeah.
the basics of it, and then you can't go wrong. You can't go wrong
Right.
if you
Isn't
know
that
the basics
nice
and the
that,
mechanics, right? If you go back to anatomy, you got this, right? And
right?
so,
Oh, isn't that nice? Oh, isn't that nice that we
yeah,
learned something for a reason?
I know, and
Before
we're
we,
still using it.
right? Oh, that's good.
I know,
Glad
right?
like 20 some odd years later.
I know.
We were talking before we pressed record that I remember when you were pregnant. I was working with you at National Rehab Hospital. You were pregnant with your oldest, who is now going to be graduating from college this year.
Mhm.
Um, I don't remember understanding what your pregnancy or postpartum experience was because I was a 20 something that wasn't where my head was at. I would love for you to just dive quickly back into
My goodness.
that.
Okay, so with the first pregnancy, I honestly can say the two pregnancies, they were relatively easy. I don't recall any significant issues during the pregnancy. I remember doing prenatal yoga. I remember going out on walks. I remember swimming with the first pregnancy, not so much with the second pregnancy, um, and worked full time.
And that was the
I think I
guidance
worked
that
full
many years
time.
ago.
Yep.
Yeah, that was the
I
guidance. Do
worked full
gentle
time,
things.
and I
Yeah.
think I even was getting my MBA at that time, now that I think about
I
it. I
think you
may have
were too. That's what I remember
I
because
think I did.
I don't think I was working there very long, and then all of a sudden my manager's going out on maternity leave. I'm like, "Where are you going?
Yeah,
I like you.
yeah.
Don't leave."
Yeah, I know, and then, came back, I took, I believe all 12 weeks or 16 weeks in DC, and, um, and then came back part-time, I believe 3 days a week. Postpartum wise, I had a natural delivery, a vaginal delivery. Oh, I did because of the information we had. I was doing my own self perineal massage because I was determined not to tear or have a
Mm,
significant issue with my pelvic floor. I don't think I did, and but the one thing I do remember right now is it's like the issue with breastfeeding. Like
mm.
how do I manage this thing? How do I manage time and breastfeed and nurse and pump and and still socialize with my friends and my family and and how to pull
Yeah.
it all
We
together.
were social
And
too, our crew back then.
yeah, I know, right? We were very. So I think I remember that being an issue, and then just getting back to activity.
Yeah.
I think I just got back to just
Mhm.
walking with the stroller and the baby stroller, and just being outdoors at that time. But I think, and then with the second pregnancy, again, just because I just didn't have time between bouncing between the first one and figuring it out. That's when I ended up resigning and thought it would be much easier and better if I started my own business.
Yeah. And I think you were
Relatively
right. Yeah,
speaking.
that worked out for you, yeah.
Yeah, right. I don't know about
Totally
the
worked out.
flexibility part, but yeah, it worked
No,
out.
I isn't it funny to kinda look back and, just what we I mean, I'm trying to think if we didn't see that many moms unless they had really severe issues, like 20 some odd years ago, we didn't see moms, like, that wanted to return to run or return to tennis. That just wasn't what was on our schedule, that wasn't what it was referred.
Yeah, no, I don't think I think the mindset wasn't necessarily there. I think
Yeah.
it was just there was definitely far and few between the ones that wanted to get back to activity. There were I recall a couple of postpartum moms where they wanted to come back because they wanted to prevent an issue. I want to come
Mm.
back so that
Yep.
and I think that was just because they did their own research or
Right.
their friend may have been talking about some issue, but it was not regular practice by any
No.
means.
No, I'm trying to
Um,
remember, like, most of what we saw would be, moms later on, yeah, I think if they were in their 40s or 50s with prolapse or leakage or something like that, and they were considering surgery. Granted, we were working out of a urogynecologist office, sometimes. But
Hmm.
it's really interesting to kind of look back and be, because I see patients now that, like, the other day, someone, she's like, okay, I want to come in. I'm 6 weeks pregnant. I'm like, okay, let's just wait a little bit. Unless you're having issues, moms want to come so early. That wasn't at all standard just 20 some odd years ago, which
No,
is
I
kind of
I
cool.
agree. I agree. And I think back then it wasn't, the issues with postpartum weren't openly talked about.
No.
Didn't the issues, whether it's pelvic floor issues or your diastasis, or your belly isn't shrinking back the way it is, or your breast issues, body image, sleep issues. No one
Yeah.
really talked about any of that. It was
No.
always the focus on the baby, right?
Yep.
And I think now we have women in general, it's positive to talk about it. It's not negative to talk about it. And
Yep.
I think back then, 10, 20, 30 years ago, I felt like there was this negative underlying connotation to talk about struggles of
Mm,
postpartum. Whereas I feel like now, we've spun it to the positive.
yeah.
It's a good thing to talk about it and look, and it just makes one stronger. It's made our,
Yeah.
you know, and so I think, and as people have more awareness in talking about it, I think that's where we're seeing a lot more of this population within our clinics,
Yeah.
which is great because we can, educate what to
Yep.
expect. It's a fourth trimester.
Yep.
It's and if they know in advance, like a lot, whether it's the layperson or the elite athlete, I want to say at least 99.9% of them, they're like, I didn't realize this would happen. No one told me about this. No one told me I would
Right.
have a diastasis. No one told me
Right.
I would have, issues with my back or whatever it might be.
Yeah.
And so, but now that there's this education initiative, this
Yeah.
movement, I think it's been wonderful. I think it's great.
Yeah. No, and I think that's, so cool how our field has kind of evolved with it. We were chatting before too. Like, when we first started in this, we could name all the DMV therapists probably on two hands. And now I don't know who half the people are around doing it, because it's just exploded. I mean, I
Hmm.
did not want to go into pelvic floor PT. That was not why I took the job there. It was, I needed to get out of, podunk middle of nowhere, and that was what I needed to do to do it. But that choice, like, completely changed the trajectory of my
Hmm.
career, and I don't think I understood, like, at the time. I remember looking up what pelvic floor PT was, and it wasn't even called that. It was called women's health, because, we
Right.
weren't really treating men then. And literally it was, if you're got leakage or prolapse, we're going to do Kegels. I don't think we even talked about diastasis. And if you had pelvic pain, like, remember what was this weird thing? I was trying to remember the other day. Like, after a shower, you're supposed to put on, like, was it like Vaseline, and then, like, blow it with, like, a cool setting on a hairdryer? Do you know what I'm talking about? It was like for vulvodynia or something. It was to lock the moisture in. I am not making
Um,
this up, I swear to God. What, we're gonna have to, like, three-way with Karen
we're gonna have to
Ledbury.
look at it. Yeah. Yeah,
No,
exactly.
there was, like, it was, like, weird things. Remember the cotton white underwear, and don't douche, and do, like, that's what we had for pelvic
Yeah.
pain.
Yeah.
And you look at that and you're like,
I remember
"Oh my,
Mr. Frosty.
Mr. Frosty."
I remember
I
Mr.
remember Mr. Frosty.
Frosty.
I forgot. Okay, just for the audience who does not know who Mr. Frosty is, what was Mr. Frosty?
Oh my goodness. Mr. Frosty was crushed ice in a condom.
Yes,
Wow.
because your
And that,
vagina was irritated or inflamed, and that was to cool
right.
the inflammation, right?
Is
Holy crap.
absolutely.
That's what we had 20 some odd years ago. So if you're not
Mhm.
feeling, what you've got offered now, it could be worse.
That's right.
Jeez. We didn't have a lot to choose from, like that. But again, like, I can't imagine ever working in a job where things don't change from day one to day 20 or 25 or whatever it is. So
Right,
in
right.
that
Well, I think
respect,
we're both fortunate in this profession, right? I mean,
yeah,
it's such a dynamic profession that we're not working like we were working 25 years ago.
no,
We continue to evolve, and I think that's why we enjoy it, we love it,
yeah,
and we're good at it,
Yeah,
because we
because
do
we
it with
like it
passion.
too. Yeah, and
Yeah,
again,
we do.
I think we were both talking too, like, to think about where we were and what we're doing now, I don't think either of us had a sense of, you
Mm.
would be traveling the world with the Women's Tennis Association and being on task forces that change policies and impacts future tennis players, and, like, why would we have ever thought that,
Yeah,
sitting in our little office
exactly. I know.
on Irving Street in I don't think we would have, but anyway,
No,
all right. At
no,
the
we would have
end
been
of
able
every
to.
episode, I ask everybody a couple of questions, very random but fun. What's a book you're reading or a podcast you're listening to right now?
Oh my gosh, I hate to say I'm not.
Okay, but let's clarify because
I'm
you just got back
past.
from Bhutan and you like went
Yes.
on a meditation retreat with a bunch of amazing women. So like that counts too. Like
Oh, that does. Okay, 'cause like I haven't done a podcast recently, and because I was traveling, and I haven't read a book because I was enjoying the scenery.
that still counts and gives us life goals to to work
Okay,
towards because you're an empty
that's
nester
great.
now.
That's
All right, I'm going to change some of these questions since you're in a different space than I am. Usually I ask favorite activity since becoming a mom. I'm going to ask you favorite activity since becoming an empty nester.
Oh my goodness. So I enjoy running.
Yay! Welcome
I've become a
back.
runner, yes,
Love
and
it.
I'm hoping to, like, I've run a 10K, and I'm gonna hopefully do another 10K soon,
Ooh,
yeah.
I see a 10 miler in your future.
Oh,
They're
I don't know
actually
about
really
that. I
they're
don't know about
really
that, and the
fun.
other thing is just going out with my friends, like, being able to catch up on a weeknight. Who did that
Mm.
before, so, yeah.
See, this is all to give me hope because I'm the chauffeur
Mhm.
from like 4 until 9 p.m. All right. I'm going to tweak this one. Usually I ask one piece of advice for new moms. I'm going to project ahead and be a little selfish here. What's one piece of advice for moms who are chauffeurs half of their day and, they're trying to work and their kids come home with like grenades because, they're going through puberty and all that stuff. Like I'm selfish. I want to know what your advice is for me right now.
Um, to see if you're able to carve out that little bit of I thing that you enjoy, whether it's
Yeah.
eating a piece of chocolate, sipping a glass of wine, or reading a nice book. But even whether it doesn't need to be for 30 minutes, even 5 minutes, being able to have that little bit of this regrounding. For me, it was honestly jumping into the shower. That was my time of
Mm,
like, that was my alone time of
yes.
being able to regroup and remember you're still a person. And
I like that.
often we get pulled in many different directions, but um the way I function is if I'm being pulled by different directions, then I don't have a good foundation. How can I help others?
Yeah.
So if I'm able to kind of reground myself, whether it's eating a piece of chocolate or having a glass of wine, and then I'm able to be that chauffeur and be able to be the homework helper and being able to be the chef, so
Yes. 7th grade math might kill me, by the way. That's another podcast episode.
Oh, I
I
gave
thought
up math after, middle school.
I'm
Well, they're
delegating
teaching
out
it the wrong I don't wanna say
the
a wrong
wrong
way,
way.
they're teaching it in a different way
It's the wrong way.
that I
I
don't
I
understand.
I will go to my grave on that one, and I can only YouTube so much. I thought I had reclaimed my bathroom time, but our little 4-year-old border terrier, she's like my shadow. I don't mind because she's kind of like my third kid that I didn't have to like give birth to or,
Mhm.
feed or that sort of thing. But she follows me everywhere I go, which includes the second I go in the bathroom, she's like scratching on the door.
Oh.
So no, I do not have my bathroom time yet. All right. I want to know, like, who is inspiring you right now? Kind of, we can just say in the women's health or female athlete space, like who's got you excited right now? Who's doing good work?
Oh, I th like, uh, I mean,
Give a shout
are
out to
you
your
talking about, like
colleagues. Yeah,
I
like
mean,
who
are
are you
you
working
talking
with in
are you
WTA?
like I wasn't sure exactly who meant, like an instructor or a PT
Anybody
person?
who's doing good work?
Um,
Like who are you
I
working
mean,
with in
I honestly think
WTA?
I am
Like,
meeting so many, so many, so many smart women
yeah,
specifically, and I think they're all wonderful in all different fields. I mean, I think my business partner is amazing. I think the Hologic team, the task force is amazing. I honestly think pregnant postpartum person is amazing. So, I think collectively as a whole, we're going to do amazing things.
Yeah, total shout out to Miriam Graham, your business partner, by the way, that I have gotten to know through you, because she left, I think, NRH before I got there, and you guys are just lovely humans, period. And she's just, she'll post something about her lifting weights and then some like goddess amazing yoga pose. I'm like, okay, that's
Hmm.
life goals for me.
I know, right?
Like I want to,
Inspiring, very inspiring.
right, hundred
I was,
percent.
if I could only just take that much from it, right?
Right? Just a
I've
tiny
accomplished.
little bit.
Yeah.
Exactly. I need to find that friend that's gonna take me to Bhutan.
Hmm. Right.
All right, last one, because you have, I think, such good perspective. You've got 2 amazing daughters that are doing really cool stuff. They're gonna be graduating. One's gonna be graduating this year from college. You work with new moms and more mature moms all the time. Like, what does it mean now in the rear view to be an active mom in postpartum?
Oh, so I immediately to mind comes to just be present. I think active doesn't mean like going out on a run, but active to me means just to be present. Time flies. I mean, like what you mentioned, I have my daughter who's a senior in college, and you know I didn't think this day would ever come, but it is coming and it's
Yeah.
here. And so I think just being there, available in the moment, I think that's being active.
Yeah, and you've been such a great role model for them. They're so lucky to have
Thank
you.
you.
And again, I cannot believe, because literally remember when Cyrus was in your belly, I'm like, how is this possible that she's
I
graduating from
know. She's
college?
graduating. Yeah. They may not think I'm a role model because but hopefully eventually
Someday they will.
they will.
Someday they will, and they'll be
'Cause
like,
I'm just
oh,
mom, right? I'm just
my
mom.
mom is
Mom.
pretty freaking badass.
Yeah.
I love that. All right. If you would like to know more about Reshma and her practice, you can find her on Instagram, Reshma Patel Rathod. Rathod, sorry. And then at Restore Motion, you can find her on Instagram there, and then follow her massive adventures all around the world with the Women's Tennis Association. Thank you for everything. I don't know
Oh
that
my
you
gosh, thank you so
realize
much for asking and
the
thinking of
impact
me. What an honor.
the impact on tennis, the impact on me. Again, you put up with 20 something me. Like,
Oh my gosh. And we're still friends and we
right?
still
And we're
support
still
each
friends.
other,
Exactly.
You're still part of my village.
Exactly. Exactly. All right. Well, thanks so much for being on the show. I appreciate it.
Thank you so much, Carrie.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.